Hi, I'm Dr. Jan Hux, a volunteer at Diabetes Canada. A lot of people have been asking questions about the risk for COVID in people with diabetes. Some people think that there's a greater risk for people with type 1. Some people think it's only type 2. Some people don't know, and there's a lot of confusion. And since people are already pretty anxious given the disruption of their lives, adding confusion on top of that isn't helpful. So we'd like to try and address some of that. But before I do that, I do need to acknowledge that we don't have great data yet. This is a new disease, and so we haven't been collecting data and analyzing it for a long period of time. If you asked about the risk of heart attack or amputation in people with diabetes, we'd be in a much better position. We've got 30 years of high-quality Canadian data that have been put through sophisticated analyses. But with COVID, not so much. So we're going to give some rough estimates, but please recognize that these results may change over time as we get better data and they're put through more sophisticated analysis. I think the data to date suggests that if you live with type 1 diabetes and your blood sugars are well controlled, then there is no additional risk of either getting COVID or having poor outcomes with COVID. For people with type 2, and particularly people living with obesity, the picture may not be so positive. Those people with type 2, and particularly those living with obesity, seem to have an increased risk of contracting COVID and have poorer outcomes when they get it. So those people need to take particular care in reducing their risk of exposure. What can we do to reduce the risk of developing COVID? I think you've heard this, but I want to reinforce that we know it's true that you need to physically distance yourself. Isolation is the best enemy of COVID. We need to stop the transmission of the disease, and we do that by not putting ourselves in a place where we can be exposed. The second is frequent hand washing. Hand washing with soap and water for 30 seconds. This makes a difference. It can start to feel a bit routine and boring, but it's really important, and it's the best thing you can do to protect your health and the health of others. Is the instruction the same for everyone? Yes, all of us need to do that. Even those people with type 1 and well-controlled blood sugars who I've just said aren't at an elevated risk, you're still at the same risk as everyone else, and you need to practice physical distancing and wash your hands frequently and properly. Some people, though, are at elevated risk. One person wrote into us and said, I've had type 2 diabetes for years, I've already had 2 heart attacks, I've had a defibrillator placed, and I recently had a bad episode of the flu. What should I do? You need to practice social distancing, and you need to wash your hands frequently, and you probably need to take extra precautions. Let somebody else get your groceries for you. Stay in the house unless you can find an opportunity to go outside where you won't be facing close exposure to other people. One other thing, and I was ambivalent about whether I would raise this, is we know that people who are smokers are also at elevated risk. The best thing that you can do for your health at any time if you're a smoker is to stop smoking. And for some people, this may be just the opportunity to take that step. So I encourage you to do that. But I also acknowledge that in this context of raised anxiety, stress, and uncertainty, that just may not be possible for you this week. Advice still remains, but acknowledge that that's going to be a hard one. One other risk I want to mention is about a month ago, some studies came out suggesting that some blood pressure medications in the class of ACE inhibitors and ARBs carry an increased risk for bad outcomes with COVID. That was based on some theoretical considerations. Concerns were also raised for some pain medications like ibuprofen. I think the data at this point don't support those risks, and I would certainly encourage you to speak to your healthcare provider to get their advice before you make any changes to your medication regimen. The good news is that many providers are now offering telephone visits, and you can get that advice without leaving the comfort of your lazy boy chair. Thanks for being in touch with us. I want to reemphasize that message we've been receiving, that during a time of physical distancing, We need to make sure we aren't socially distanced. We need to reach out for help and connection. And I'm glad that you're finding Diabetes Canada a place where you can do that. Stay well.
If you get COVID-19 or think you might have COVID-19, the first thing is don't panic. You will need to take some extra care to look after your diabetes. When people get sick, very often their blood sugars run much higher than normal, even if they're not eating as much as usual. So check your blood sugars more regularly than normal and follow the sick day management protocols, which you can access at diabetes.ca. Alternatively, you may have sick day management guidance that you have received from your own regular health care team. You may already have guidelines that you've been given by your own regular diabetes care team. If you're sick, it's important that you take care of the people around you, so you may need to isolate yourself from other family members. This means sleeping in a separate room, not sharing meals. If you have type 1 diabetes, don't stop your insulin. You need to keep taking insulin even when you are not eating. Please check your blood sugars more regularly than normal. If your blood sugars are running high, you may need a correction dose of your short-acting insulin. But again, keep going with your long-acting or basal insulin. If you think you have got COVID-19 and are sick, you should isolate yourself. Don't go to work, but isolate yourself at home. This will help protect your family. This will probably mean staying in a separate room and sleeping in a separate bed from family members. It's very important to be careful around the time of eating and drinking. And in particular, you shouldn't share cups or bowls or other implements with other family members. Take care if you're using cutlery to serve yourself meals. It's probably safest if a family member brings you food to eat that you eat using your own cutlery. If you do need to go to hospital, it's worthwhile bringing all of your diabetes supplies with you. This is particularly important if you use an insulin pump. If you want to continue using your insulin pump, it's important to indicate this to the healthcare team looking after you. If you become so unwell that you're unable to look after your pump yourself, the doctors may wish to switch you from the pump to either intravenous insulin or regular insulin injections. Most larger cities and most provinces will have pump expertise available, and if you're in a centre where your doctor isn't comfortable with a pump, you can recommend that they call the endocrinology team at the nearest large centre for advice about how best to manage this safely. Period. Most important is to remember to bring extra infusion sets and reservoirs with you. Not all hospitals will have exactly the same brand of insulin that you use, but switching to another brand of insulin temporarily is not a problem. Don't worry that you and your diabetes will not be looked after. We're all looking at ways that we can promote social distancing, and many diabetes clinics are already operating remotely, doing phone calls, video calls, and using other strategies to perform diabetes care remotely using all the technology that we have available to us. Don't worry that your diabetes will not be looked after during this pandemic. Diabetes centres and clinics are already operating using virtual technologies, including phone calls and video conferencing, to take care of your diabetes and support you through this difficult time. There are rumours that access might be limited, but please remember that diabetes care has been judged to be an essential service that all hospitals will be trying to maintain just as good, high quality care, but perhaps delivered a little differently than normal.
Access to diabetes healthcare remains available during this COVID-19 pandemic. Your family doctor, your specialist, your diabetes care team will remain available to you, but through a different mechanism, likely through virtual visits or through telephone visits, which will then allow us to maintain the routine care as well as provide things like prescription renewals and answer your questions as needed. You can help us by being available during those times and having readily available things like your medication list, your glucose levels, as well as your insulin pump data. There may also be a need to share some of that information electronically through email. We are committed to remaining available to you in order to help maintain health, but also to help minimize visits to urgent care or to emergency departments.
We have heard that there are many concerns about insulin shortages in Canada. We've been assured by Health Canada and the manufacturers that there are not currently any shortages of insulin in Canada. However, you can help by not stockpiling medications. You are asked to have 1 to 2 weeks of insulin on hand and that you fill your prescription every 30 days. If your insulin needs have changed and you need more insulin than before, talk to your pharmacist and talk to your physician. They can help you make sure that you get the insulin that you need.
We know COVID-19 has put lots of people under a lot of financial strain. If you have been laid off, visit canada.ca to access employment insurance benefits and the newly introduced Canada Emergency Response Benefit Program, CERB. If you need help paying for diabetes supplies and medication, you can check with your provincial or territorial government's healthcare program to see what support is available. The manufacturer of your insulin or medication likely has a compassionate care or patient assistance program that can help you access medications, so contact them directly. If you need financial support for other things like food, clothing, shelter, visit ceridiancares.ca, and that is ceridiancares.ca.
We at Diabetes Canada are more committed than ever to supporting the needs of people with diabetes and pre-diabetes. Yes, we've had to adapt our programs due to COVID-19 and our operations have changed, but we are being creative to find new ways to meet the needs of our community. We are working with other patient groups, hand in hand with them, along with healthcare professions and patients to answer top questions through videos and webinars. We're continuing our advocacy to make sure that the interests and needs of people with diabetes are looked after. We are there for the community. Canada is adapting, we are adapting, but with your engagement and with your support, we will be stronger once this crisis passes.
This COVID-19 pandemic has increased anxiety, stress, and fear for everyone. And I think it is especially important in these days for us to remember what are the things that we can control and what are the things that we cannot control. The things that we can control are our own habits around washing our hands and physical distancing. And for those living with diabetes, remembering the importance of blood sugar control, testing your blood sugars perhaps more frequently during this time because stress can certainly raise blood sugar levels. And depending on those values, you may need to adjust your insulin or other medications, and your healthcare team is available to provide that advice. But things that we cannot control are what's going on in the great big world around us. And therefore it's important that we try to remember that, or else sometimes watching the news and hearing about what's going on can further increase that anxiety and stress. When you're starting to feel it accumulate, that may be a good time to go for a walk outside by yourself, maintaining physical distancing, or doing some meditation or yoga or physical activity. All of these things can be helpful to help reduce stress levels. Reach out to a friend if you need someone to talk to There are plenty of technologies available now to maintain our social closeness, but still have physical distancing. And then, of course, if necessary, reach out to local crisis centers or check out the Mental Health Commission's list of COVID-19 resources for people to talk to. So I hope everyone stays safe and manages their stress levels as best as possible in these difficult times.
So we've had a look at all the great things that are going on across the country to help us stay connected and supported through this time, and wanted to share a few with you. So if you are a kid living with diabetes or you are a parent living with diabetes, head on over and check out the DCamps page, because they've got some virtual camp options going on to make things still feel campy while we are indoors this spring. If you are a youth or a young adult living with diabetes, we suggest that you head on over and check out Diabetes Hope Foundation, and they are hosting Wellness Wednesday webinars every Wednesday, connecting youth with diabetes with trained peer mentors. JDRF is doing weekly live streams with experts specifically focusing on topics related to COVID-19 and doing a great job at getting credible information out into the community. And Connected in Motion is working on turning our slipstream programs into virtual programs, which will still bring the same connection and community and sharing and learning and peer support that you're used to at our in-person programs, but happening in the comfort of your own living room. Those are going to be happening in May, one for the Canadian audience, one for the American audience, as well as one for partners of people living with diabetes in June. We also want to mention that there are lots of individuals hosting meetups across the country online, and you can head to a social platform and search for Diabetes Meetup, and you will probably find one that will connect with you.
You might be finding that eating healthy and staying active can be challenging these days, but there are some things that you can do to help you stay on track. Firstly, make sure to stock up on non-perishable foods that you can have on hand for healthy meals and snacks. It's not the time to be going to buy fresh produce every day. It's a good idea to try and limit your trips to the grocery store as much as possible. Plan your meals in advance so you know what you need to buy. Where possible, use canned and frozen vegetables and fruit. These can be just as healthy as fresh. Dried pasta, pasta sauce, canned soups, canned beans are all great options. Try picking up a few extra, putting in your shopping cart when you're out to the grocery store. And you know, avoid panic buying, but it's good to have these on hand so that if you do find yourself short on time, that you have something that you can prepare fairly quickly. Something else you might find is that you're snacking all the time or more than you used to because you're bored or perhaps feeling anxious. Stress and uncertainty can cause us to overeat and to crave sugary and fatty foods that we normally would only have as occasional treats. But these few bites here and there can actually add up quickly with carbs and carbohydrates and calories for the day. As much as possible, choose foods like vegetables, fruits, nuts, hummus. Keep yourself occupied with a hobby or other activity to prevent you from going to the kitchen so many times. It's a good idea also to try and spend most of the day away from the kitchen. The more access you have to food, the more likely you are to eat mindlessly. In fact, the best advice I could give you is being mindful of what you eat and how much and when you eat. On the other hand, if you're feeling unwell and have no appetite, you need to keep eating and drinking regularly. You want to avoid dehydration, avoid low blood sugars. Maybe having some meal replacement drinks on hand is a good idea if you do happen to have days like that. As for keeping active, there are plenty of programs available online for free that use little or no equipment at all. And it's maybe a good time to pick up yoga or to pull out those resistance bands that you've had in the closet for a while. Everyone can do something. Find what works and be consistent.